Hi, good morning Astrid. My name is Karen Jones. I'm your invigilator for the OET speaking session on the 12th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Astrid Lehman.
And what is your candidate number, please?
My candidate number is 213351007.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Do you think you are a good nurse? If so, how can you demonstrate this?
My values of providing the highest care, treating patients with compassion, and my commitment to communication make me a good nurse. I demonstrate this by challenging colleagues where necessary to ensure that the whole team provides the highest standard of care.
Describe a time when you did not get on with your team member and how you resolved it.
I used to have many disagreements with another nurse on the ward. Our personalities seemed to clash, and there were arguments about nearly everything. I decided that this was not good for the work environment and invited her to lunch one day. We addressed our differences and began to communicate and get along much better.
What is the hardest part of being a nurse practitioner?
The specialist nature of a nurse practitioner means that we face unique challenges, and it can be difficult to deal with these issues. It is difficult to know that the patient is suffering, despite everything being done for them. I deal with these situations by realizing that I have done everything I can to make the patient feel comfortable and to ease their discomfort.
What does compassionate care mean to you?
I am a naturally compassionate and caring person, as I think that it is difficult to learn these character traits. I treat patients how I would want to be treated. Being kind when listening to patients and addressing their problems is one way to show compassion.
How would you deal with a rude patient?
Every patient is different with different needs, so I will try to reduce anxiety and pain, as this can be the reason for the hostile behavior. Where a patient is being rude, I will remain calm and compassionate to reassure the patient. If the rudeness escalates to abuse, I will escalate the situation to my senior.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning, Karen. My name is Astrid Lehman. I will be your attending nurse here in this ward.
Good morning, nurse.
I am here to do the clinical observations, like checking your weight, heart rate, blood pressure, etc.
Okay, nurse.
Well, how are you feeling, Karen?
Nurse, I have been feeling very tired. And also, my legs are uncomfortable because of the swelling.
Sorry to hear that, Karen. As you have congestive heart failure, one or both of your heart's lower chambers lose their ability to pump blood effectively. As a result, blood can back up in your legs, ankles, and feet, causing swelling and is called edema.
Oh, I see.
Try not to worry, Karen. Treatment for edema is possible, and found to be effective for patients like you. I will provide information about treatment to reduce swelling.
That's great, nurse.
Leg edema, related to congestive heart failure, can be treated with a diuretic, sometimes called water pills, which could help to get rid of your body salt, sodium and water. So, when you can pee more, fluid from the legs can flow back into the blood. For this, a cannula is inserted into a vein, and the diuretic is given by infusion over a few hours. You may have already received this treatment on previous admissions to the hospital.
Yes, nurse. And I am not very happy about being given diuretics. It is because in case I may not get to the toilet in time. Or else, I would like a bed near the toilet.
I totally understand your concern, Karen. And your thoughts are sensible too. However, toilet use is not possible in your case.
But why? I would much rather use the toilet, but I didn't understand why you say I can't.
I will explain to you in detail why you can't use the toilet for urination.
Okay.
Karen, it is because the volume of urine needs to be measured. Hence, you can make use of a urine bottle or commode.
Oh, really? Is it actually necessary?
Yes, Karen. Don't worry. It is to check the effectiveness of the medication, and also to have a better understanding of reduction in edema.
Okay, nurse. I understand that. Nurse, will I be allowed to go home if the swelling goes down?
Your question is quite reasonable. Perhaps, Karen, further tests before the discharge are necessary.
All right.
It is to check the side effects of diuretics. Levels of potassium and sodium have to be determined.
Nurse, I hope I won't be in the hospital for too long. It is just because the last time when I was in the hospital, I felt really down.
I understand your situation, Karen. However, it is for your well-being. You are being kept in the hospital for a specific duration of time. During that time, support from the medical team will be available for you, which is absolutely necessary for your condition.
Yes, nurse. I know that.
Also, Karen, visitors will be allowed any time, so that you are not restricted from your loved ones.
Good to hear that, nurse.
I know, these will not make you feel more comfortable than being at home. I reassure you that your discharge will be done as soon as it is practical.
Thank you for your assurance, nurse.
Karen, I would like to take your clinical observations. Can I have your consent to begin the clinical observations, please?
Yes, of course. You may please proceed.
Thank you for your consent, Karen.
That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.